7,000 individuals across this community. Our primary service area is Kitsap County, though we do serve people in Mason County and Jefferson and Clallam in certain situations as well. We have 470 full-time and part-time staff. That translates to about 14 full-time equivalents. And we're often seen as a training ground for new clinicians, because in order to be licensed, you need to put in 2,000 hours under supervised services, and we do that for clinicians across our agency. Primarily, we contract with managed care organizations to provide services to Medicaid patients, but we also do accept commercial insurance, and we're increasingly contracting with multiple funders for a variety of specialty programs. So what I'd like to say is that feel free to raise a hand, stop me at any point. Happy to answer any questions that you might have along the way. If I don't see your hand raised, hopefully somebody will see it and call it to my attention, but I'm happy to stop and go down whatever path that you find helpful. So from a Kitsap Mental Health Services, we have a mission of offering hope and opportunity to people of all ages through comprehensive recovery-oriented behavioral health care. And that's not just a statement to us. It's something that our board revisits continually. It's a mission statement that was expanded a couple of years ago when we made the decision to grow into the housing sphere more directly with Pendleton Place. But when we say offering hope, our clinicians really, when they're in front of somebody, they talk often about holding the hope for somebody that's sitting in front of them when they can't hold it for themselves. So when they're meeting with someone, they're really trying to get them to a place where they can move from a place of hopeless to a place where they can actually see hope in their future. And opportunity to us is really not just about providing mental health care services. It's really about providing the broad spectrum of services that people might need to get to a place of recovery. We do offer services for people of all ages. We're actually looking into developing an infant mental health care practice, but right now it's from early toddlers all the way through older adults and everything in between. When we say comprehensive recovery oriented, we're talking about everything from outpatient services to children and adults, as well as 24/7 inpatient services and housing as well. And behavioral health care is inclusive of both mental health and substance use. And we've also have integrated healthcare services, primary care and dental on our campus as well, which many people may not realize. So it's a very comprehensive mission. It's not just a mission statement to us. It really does guide the programs that we take on and that we and the way that we deliver our services to this community. So, when I speak to individuals in the community, I recognize that people have a broad range of experience with mental health. We have people who work in the industry. We have people who've benefited from mental health services themselves, with people close to them personally who've been experiencing mental illness. But I take it as grounded on some basic facts about the prevalence of mental illness in our community. It's way more common than people realize. 1 in 5 American adults experience a mental health issue, 1 in 5. And 1 in 25 Americans live with a serious mental illness like schizophrenia or major depressive disorder. And that one took me aback when I first read that. And in the United States, almost half of all adults will experience a mental health issue in their lifetime. So it's a very prevalent condition in our community. It's often stigmatized as something that's over there or something that's wrong with someone. But the reality is it's no different than someone who might be living with a diabetes condition or a chronic heart condition. It's just that in this particular situation, it involves people's brain and thought processes. And I also like to point out that there's a lot of stereotypes, especially when it comes to, and I know you've heard us talk about Pendleton Place in the past, but there tends to be a lot of community stereotypes about people with mental illness that that they're criminals, that they're drug dealers, that they are violent. And in the reality, only 3 to 5% of all violent acts that happen across this country can be attributed to someone living with a mental illness. And quite frankly, people who live with mental illness tend to be much more likely, 10 times more likely, to be the victims of violent crime. We see that happen all the time, especially people that are living on the streets. They tend to be the prey, if you will, where people have predatory behaviors. They try to, there's victims of violence, they're victims of people trying to get access to their Social Security income, all types of things, move in with them if they do have housing. So they tend to be much more likely to be victims. And here's the other thing, that people with mental health issues do get better and many recover completely. And that's what we truly believe in. So with that as kind of our backdrop, we all have seen and heard in the news that the demand for mental health services is on the rise nationwide. This is just a few of the headlines that I clipped yesterday on a Google search from the last week. Looking at, these are nationwide, of course, suicide attempts have increased during COVID. Nobody has openings. Mental health providers are struggling to meet demand. I can tell you that similar community behavioral health centers like Kitsap Mental Health Services across the state, more than half of them have closed their doors to new clients. More than half are not taking new clients. There's a waiting list. That's how strapped it is. And it's not as if people don't want to help. It's that they can't keep their doors open because they can't provide the quality of services that would be needed by that individual. So we know that demand for services on the rise, and Kitsap Mental Health Services has a broad range of services to meet the needs of our community. What we're most known for is our outpatient mental health services. We provide them for youth and adults, and these include services such as talk therapy, peer support, care coordination, medication management, outpatient substance abuse treatment, and more. We operate 5 24/7 facilities in the main campus, including a youth and an adult inpatient unit. The adult has 16 beds and the youth has 10. We have a crisis triage center, a substance use residential treatment center, and a mental health residential treatment center. And all of these facilities are located on our main campus on Elmira in East Bremerton. We operate 2 classrooms serving 24 students from K through 12. These are staffed by educators and therapists. And we serve school districts across Kitsap County, but also Peninsula School District. And we have 1 student from University Place as well. That is because it's a very unique model that we're able to offer. We are the provider of designated crisis responder services. So when somebody is in a crisis and they are concerned about themselves or others being a danger to themselves or others, a designated crisis responder would get dispatched, and those services are operated out of Kitsap Mental Health Services. We also partner with law enforcement. We have services in the jail. We actually have a courtroom on our campus. Many people don't realize that. And we also offer many high-intensity wraparound services, and these would be outpatient programs. One is called the Program for Assertive Community Treatment. It's called PACT. And this would be individuals who have very intensive mental health or substance use needs, often co-occurring. And we have a wraparound team that's comprised of a clinician, a physician, peer support, a nurse, a care coordinator, and they work with these individuals with very low caseloads and wrap the services around them. They're trying to have contact with them daily. So it's a very intensive program. We are just now launching a new program called New Journeys. It's an early psychosis intervention, really focused on young adults, where there's often a first break of psychosis. And if you're able to intervene with wraparound services at an early age, say 18 to 20 to 22 years old, you can have a much higher likelihood of a good outcome and recovery for those individuals. So that program is just now launching. We also have a wraparound program for youth and families called WISE. It's an intensive services program for youth and families. And to support all of that, we also offer housing and employment programs. So you can see that we have a broad range of behavioral health services meeting the needs of those in our community. So I'm going to go into a little bit more depth on the types of programs specifically that we offer. And I would tell you that I am not a clinician myself. I am an accountant by training and a social worker about 10 or 12 years ago. But I work with some of the finest clinicians in this community, and they are the heart and soul of the programs I'm about to describe. So all of KMHS services are guided by core clinical values. We operate using a recovery model of care rather than more of a medical type of model. We have a trauma-informed care approach, which I'll talk a little bit more about. And our most, if not all of our services, definitely most of our services are supported with peers as well. So we'll talk a little bit why that's important. So what is a recovery model? Well, when we speak in the community, we often say, we know that recovery happens because we see it every day. And the idea is not that somebody is going to go from low functioning to completely normal functioning. Recovery really embraces this concept that we help people get to their highest level of functioning possible, where they are able to thrive as their essentially their best self. And it's a very comprehensive type of view. It looks at their health. Are they able to engage with a primary care to manage their disease or symptoms and make healthy choices in life? Do they have a stable and safe place to live? Very, very important. If you don't have that, it's very difficult to deal with things like mental health and substance use issues. Do they have a sense of purpose in life? Are they conducting meaningful daily activities, generating income or work or volunteerism? Are they participating in the community in any way? Do they have those relationships and social networks that support friendship and love and hope? All of these, this is kind of a multi-dimensional approach to mental health care. So it's not just coming in and meeting with your therapist and having a 45-minute session and coming back a week later. It's a very comprehensive approach that, you know, we have care coordinators working with individuals to get them connected to healthcare services and community-based services. We have psychiatrists who are able to prescribe the medications that individuals may need and monitor those medications. We have peers who've come through the mental health spectrum themselves and are able to walk alongside these individuals. So it's a very comprehensive model. We're also guided by the concept of trauma-informed care. And it's really recognizing the widespread presence of trauma in our lives. You may not realize this, but roughly 50 to 60 people will, 50 to 60% of individuals will experience some level of trauma in their lifetime. And about 90% of people that are engaged in mental health services have experienced trauma. It's not often, it's not just a single experience. If you think about someone who's homeless, there's an extended period of time where they're dealing with the trauma of feeling unsafe, of being victimized, of not knowing where their food is coming, that kind of perpetual trauma. You also could be living with someone who's had very acute experiences of sexual abuse or other types of violence in their lives. All of these are things that have happened to individuals. So when you're trauma informed, you're approaching the person in front of you, not as, what's wrong with you, what's not going right in your life. It's really through the lens of what's happened to you, and really taking that sense of trauma in and letting it be kind of the backdrop as you're working with individuals. So we have to help people find their paths to recovery through their trauma. We've changed our organizational practices. We're very focused on patient empowerment. We don't tell patients what's going to be the plan for them. We engage them in their treatment plan. They actually, when clinicians develop a treatment plan with individuals, it's with their clients sitting right next to them, helping them decide on what the goals, what's important to them. So it's very patient empowered. They have choices about what they want to participate and what they don't want to participate in. And throughout, we want to create a sense of safety for individuals. It's very important, if you're going to recover, to have a sense of trust with the providers that are working with you. Most of our programs are also supported by peers, and this could be in the form of like our WISE, our wraparound intensive services for youth, that would work with youth and families who are not really, youth that are really with some severe mental health issues, but may not be in an inpatient setting. We have parent partners who have really experienced that themselves in their own lives and now are employed by us to walk alongside other parents who are dealing with the same experience. We have peers in our crisis programs, in our substance use treatment programs, people who have come through those experiences and are walking with other individuals, and each one of our outpatient teams has peers as well. So each one of these elements, a recovery model, trauma-informed care, and peers, kind of guide our philosophy for the programs that we offer. We have many locations across this community. Our main campus is in Bremerton on Elmira. I'll show you kind of location. It's just up from Lowe's on the hill there. And that's where most of our services are located, where our adults and child and family services are located, our crisis and 24/7 services, youth inpatient, adult inpatient, our 24/7 programs, and our administrative offices. Last year, we opened a site in North Kitsap on Hostmark Street, where we offer adult and child and family services, as well as medication management. On Bentley, which is where the doctor's clinic used to operate an urgent care center. That's where our WISE program is headquartered. On Sheridan Road in Bremerton, we also have child and family outpatient services. And we do have a presence in South Kitsap, but we are moving to a new site on Bay Street that is about to open here in the next month. And we're very excited about that. We're going to have adult, child, family, and WISE program services there as well. So really trying to make it as convenient as possible for those who might need our services. Let's see here. So our main campus, what you're looking at here, so here's Wheaton Way, and here's Lowe's, and here's Fred Meyer. We're just up the hill there, and this is kind of the broad KMHS campus. This is the Illahee Preserve here on the right. So just to get you grounded in our main campus. And more specifically, on our main campus, at the north end, we have our crisis triage center and our Pacific Hope and Recovery, which is our 30-day residential substance use treatment program. We have an inpatient facility for adults and for youth, and our courtroom is located in this building. And we have a transitional residential unit that's known as Keller House. So I'd like to kind of follow the story of one of our clients to kind of show you how people move through our programs. And it's often not that somebody will just come into one service and leave. They may come into acute services and then step down to other types of services as they progress in a recovery. So Jay is a 55-year-old truck driver. He was struggling with emotional issues from his own rough childhood. He came to Kitsap from Tri-Cities to stay with his sister after he lost his job with COVID. He's long been dealing with depression. It was affected by his loss of income. He was estranged from his family, and he took solace when he overused the pain pills that he got for his back. He lost his doctor in the move. He ran out of medication. He's been struggling with withdrawal, clinical depression, and a general sense of hopelessness. And he was wondering why he was still alive. And that's when he came to our services. So he initially came into our crisis triage center. And that's where we offer short-term stabilization for services for anybody that's in a crisis situation that doesn't need kind of a inpatient unit lockup type of situation. And then he transitioned to Pacific Hope and Recovery, which is our 30-day residential treatment center. So this is kind of a street side view. They're actually located in the same building, but they're separated on the inside. And both of those units have 16 beds, and they're staffed 24/7, of course. So the Crisis Triage Center, they treat individuals with depression, severe anxiety, disorganized thoughts, issues with self-care and addictions and conflicts. They accept referrals from the emergency department, law enforcement, outside hospitals, and our own designated crisis responders. They often stay anywhere from 3 to 5 days. It could be more though, depending on what their need is. And they get connected with counseling and case management, and medication and peer support. There's on-site nursing care to address any medical needs they might have. They'll get a substance use evaluation if needed. We get them enrolled in Medicaid. And these services are open to any resident of Kitsap County. Pacific Hope and Recovery is our residential addiction unit. So in this case, Jay transferred directly from the triage center to PHRC once he had a chance to participate in stabilization. And as I mentioned, PHRC is a 16-bed residential facility. Generally, people will stay 4 to 5 weeks to get the services that they need with certified substance abuse counselors and peers. They'll get 5 hours of daily participation in counseling and recovery groups. And there's ongoing opportunities for medication stabilization if that's what's needed, and case management support. So he made some great friends at PHRC, but he was still struggling. And recognizing recovery doesn't happen overnight, he needed some more time to kind of mend the relationships with his sister, to get stabilized, to practice his sobriety and treatment compliance, which brought him to our Keller residential unit, which is kind of here more at the south end of our campus. And that's just another view of it down here. Okay, and an outside view. So the Keller House is named after Larry Keller, who was kind of the founding executive director of Kitsap Mental Health Services till I believe about 2008. It's a 16-bed step-down residential living unit for residents who need some additional mental health support. And the private rooms, people are free to come and go as they please. They may stay generally up to 30 days. We used to have people stay longer, but since now we're governed by Medicaid rules, people can't stay longer than 30 days, unfortunately. But they do have access to their substance abuse counseling during that time, and they're receiving outpatient services from our outpatient team, and they're getting medication management and supervision throughout. And that facility is operated 24/7. And now I'm going to talk to you a little bit about 2 of our inpatient units, which our case study of Jay didn't engage with, but are very central to the services that we offer. So we have an acute inpatient unit for adults and one for youth. The adult inpatient unit is also a 16-bed psych intensive care unit. You might wonder why everything is at 16 beds. And that's actually governed by, I don't know if it's RCWs or federal law, but anything higher than that designates it as a mental health hospital. And then you're under a whole different level of types of standards. So we take it right up to the 16 beds in most cases. Because Pendleton Place is actually private market housing, it's 72 units of apartments. We obviously weren't restricted in that particular case. But this is where you might go if you've been deemed a danger to yourself or others. It's generally not a place for voluntary. If you're in a place where you're voluntary needing services, you'll often go to the Crisis Triage Center first. But this is those situations where a designated crisis responder who is specially trained and the only one who in this community who has the authority, with the exception of the judge, to take away your civil rights. And that is why it's so hard. People often ask, well, why can't you just get them put them in treatment? you can't, because people have basic civil rights. And so what we can detain them with our designated crisis responders, but that's why we have a courtroom on site. Everybody who's detained will meet with an actual public defender on a video courtroom with a judge and present the case, and the judge will determine if that detainment can go forward. And so it's a very structured process, and as it should be. I mean, when you have civil rights involved in people's freedom of movement, you do want a high standard there. Sometimes it's a little higher than we'd prefer, but that's what we operate with. Generally, people can stay up to 14 days, so we often do have beds for civil commitments, and these are individuals who really meet the bar for Western State Hospital. But Western has really transitioned more to a forensic type of facility, and so the state has been funding beds in the communities around the state to take civil commitments for longer term psych holds. So we often will take people for 90 to 180 days or more. I've talked to you a little bit about the designated crisis responders, but let me tell you how they're dispatched. So when you yourself or someone you know is experiencing a situation where they are a danger to themselves or others, they may call 911, they may call Volunteers of America or a suicide crisis line. All of that is going to generally get you to Volunteers of America, who will dispatch the DCRs. So we manage the DCRs, but they're dispatched by Volunteers of America. And so and I always like to remind people, if anybody, there are suicide hotlines. If anybody needs to contact that, the information's on the screen there. But if the telephone counselor determines that life or safety might be at stake, they'll contact one of our DCRs. And then 24/7, our DCRs will go across wherever they are in the county and make that assessment if they should be detained. Often it's an involuntary detainment, and the police will escort in many cases, and people are often taken to our inpatient unit against their will, and it is a locked inpatient facility. Our youth inpatient unit, it's 10 beds serving youth 10 to 17. It's unfortunately been closed for the last year and a half. It is opening May of this year. We had to close it temporarily due to COVID because we had staffing shortages, and we also were unable to meet some of the social distancing requirements. And we took that time then to do a major remodel of our youth inpatient unit. And the remodel is complete, but because it's a state regulated facility, we have to get sign off by the state. So we're just waiting. And there's a desperate need for inpatient services for youth in our community. So really look forward to it opening here very soon. And then finally, you'll see kind of in the middle of our campus is where our comprehensive outpatient services are primarily located. And for those, if somebody's coming in and receiving our mental health outpatient services, they'll be assigned to a team. We have a team approach to our services, so you're not just coming in and meeting with a counselor. You'll come in, you will see you same day. You can walk in and you'll meet with somebody, one of our mental health professionals on our access team, and they'll do an assessment with you, and they'll determine if you actually meet a kind of a clinical need for mental health services. It used to be that you had to meet a really high bar, and now it's really just because of mental health parity, now we're able just to assess if there is a need for those mental health services. But you'll be assigned to a team, and you'll have a counselor. You'll get medication management support by a psychiatric provider. You'll get a care coordination and family support and access to addiction and other specialists. We have access to an on-site pharmacy on our campus, and we take an integrated approach to our services. So Peninsula Community Health Services actually has a physician on campus. And the idea there is that there's a really close linkage between your physical health and your mental health. In many cases, your physical health, if you've got a very deteriorating condition, it can contribute and deteriorate your mental health condition. So treating one without the other really doesn't result in that recovery that you're looking for. So we do have an integrated approach with PCHS physician on site. So Jay's journey continued. He got engaged in our outpatient services, and he also got engaged in our outpatient substance use services. He's been set up with a therapist and a team that meets with him on an ongoing basis to make sure he has what he needs. He now meets regularly with his medication provider. Generally, that's once a month. He has access to his medications on campus, and he also started addressing some of his long-term primary care needs through his provider on campus. So he attends substance use groups, and he's positive about his employment prospects. This is an example of what recovery looks like. This kind of journey that we took you through, that's what we mean by the recovery model of mental health care. We do offer other services supporting that recovery, housing and employment. I do believe, and it's well known, that housing is healthcare. When you get people in housing, it has a direct correlation to improved healthcare. They're not engaging the emergency department. They're much more likely to get engaged with preventative mental health, primary care services, et cetera. So you've seen pictures. This is an older picture. We're just about to open. We're so excited. This journey, as you know, is a long time coming, 5 years in the planning. And we have our 72 people selected, and we're just waiting for sign off from the city, which is its own fun journey in itself. So I know you've heard us talk about supported housing, but Pendleton Place will be reaching the most vulnerable people in our community who need housing and supported services, 24/7 services on site to make sure to help them in their efforts to remain stably housed and live healthy lives. Peninsula Community Health Services will have, they have a room where they're going to have a physician operating out of there 3 days a week. We'll have their dental van on our camp on site once a month. So that's going to be great as well. And we truly believe in the power of supported housing. We know that it will decrease healthcare costs. We know it does improve retention, and we know it just reduces costs overall to society. And that's aside from the fact that people, the primary objective is to get people into their own home. So you might wonder, how do you access Kitsap Mental Health Services? For Medicaid eligible or uninsured individuals who need them, they can either call us or they can walk in for same-day assessment, as I mentioned. If anybody's in crisis, they may contact either 911 and get connected with Volunteers of America, or contact the Volunteers of America direct line. And there's also the National Crisis Hotline that is coming soon, which is going to be a 988 number that's in addition to 911, that's going to do some direct response. So that is kind of an overview of Kitsap Mental Health Services.